hardest part about giving up was when I was in a social setting, not knowing what to do with my hands.
So straight away, I've got to have a cigarette. It was just a habit.
The richness of just taste came back to me.
Stress, have a cigarette. Happy, have a cigarette. Sad, have a cigarette.
Well, as a fairly heavy smoker, I think anything was a trigger. I didn't really need one.
I just smoked in every.
Hi, I'm Juanita Phillips. Welcome to Health Smart. It may no longer be breaking news that smoking kills, but if you're a smoker, it remains a message you can't ignore. Which is why quitting smoking is one of the most important things any smoker will ever do. You might have tried to quit before and ended up smoking again. You might have set quit dates and put them off. It's not easy to quit, but the good news is there are products available to help make quitting easier, like nicotine replacement therapy. So if you really want to stop smoking, this video will show you how. The good news is that the benefits of quitting smoking are almost immediate. As soon as you stop smoking, your body starts to recover. In just 12 hours, your body is free of carbon monoxide. In 2 days, all the nicotine is out of your system. In 3 months, your lungs are able to clean themselves. After 1 year, your risk of heart disease is reduced by 50% compared to someone who keeps smoking. In 10 years, your risk of stroke returns to the level of those who have never smoked, while your risk of lung cancer is reduced by up to 50%. And after 15 years, your chances of dying are about the same as someone who's never smoked. So why do you smoke? You may have a multitude of reasons, but ultimately it's because you're addicted. Addiction to smoking is made up of 3 elements: chemical dependence, habit, and psychological dependence. Chemical dependence means you smoke to maintain your nicotine levels. Nicotine is the drug in cigarettes which stimulates the brain to release rewarding chemicals that keep you coming back for more. It takes around 10 seconds for the nicotine to reach your brain. This surge of nicotine is so satisfying that you immediately feel better. Over time, your body gets used to the good feelings from the nicotine and you can't do without it. This means you're addicted. You feel good when your nicotine levels are high and bad when they're low. This up and down effect goes on all day, which is why it can be difficult to give up. Being physically addicted to something can make you feel like you don't have control over your own actions. That's why a key element in regaining control is learning to recognise and then break those habits you associate with smoking.
The main trigger was getting up in the morning and having that first cigarette. I'd even get to the extent of trying to wake up early so you can get that fix, that early morning fix.
Well, I suppose everybody says the same thing, but as soon as you have a meal, I think that's a big trigger.
When I was going out in the social scene with me mates and all that, sitting around, someone, light up a fag, and it's just, the smell of the smoke around, and it's, to me, well anyway, going out drinking and all that, I always thought, oh no, got to have a cigarette, another beer, cigarette.
One of my kids that I was teaching at the time when I gave up just said it's nice that I don't have to smell smoke on your hands when you mark my work.
Understanding your addiction and breaking the habits which feed it will help put you back in control. But smoking also affects your emotions. When you smoke, you can feel safe and comfortable. But when you stop, you can feel exposed, stressed, and vulnerable. This is because your mind and body have become dependent on nicotine.
Controlling my moods would be like, it made me feel better if I was under stress, and that for some reason it would calm it, even though the problem would still be there. Lighting up a cigarette, even if I chain smoked, it would make me feel better, more calm.
When you're not getting enough nicotine, that's called withdrawal. Lots of people get withdrawal symptoms when they try to quit, and it can be really tough getting through them. It's not unusual to feel
Grumpy.
I sweat.
Very, very bad cough.
Cranky.
Restless sleeps.
Chesty.
These withdrawal symptoms are normal and a sign that your body is actually starting to recover. Failing to address these feelings of withdrawal is why many people fail in their attempts to quit. That's why nicotine replacement therapy is such a valuable quitting tool. Nicotine replacement therapy helps reduce withdrawal symptoms because it replaces some of the nicotine you get from smoking and smooths out the nicotine levels in your body. It also gives you time to change your habits and learn different ways of coping with the psychological dependence.
It just makes you feel better in yourself once you get over that initial hurdle, and it's not easy.
After you go out and not having some cigarettes, that Saturday morning or Sunday morning feeling, waking up and you just feel better in your head, feel better in your breath.
I'm fitter, I can run upstairs now, which I never could before. I can't think of anything that hasn't improved since I've given up smoking.
So what are the methods for maintaining nicotine without smoking? It can be done using patches, gum, lozenges, inhalers or sublingual tablets which are placed underneath the tongue. Patches are applied in the morning on the upper part of your body, and the nicotine is absorbed through the skin and released gradually throughout the day. They're put on a different spot each day and shouldn't be reapplied to the same bit of skin for 7 days. Patches should be used for at least 8 weeks. You can use the same dose patches for this entire time. To maintain nicotine levels in the blood using nicotine chewing gum, you must chew it regularly throughout the day, but don't chew it like ordinary gum. Chew gum slowly until the taste becomes strong, which usually takes about 1 minute. Rest or park the gum between your gum and cheek. When the taste fades, chew the gum again to release more nicotine. The gum comes in 2 different strengths for light or heavy smokers. The nicotine lozenge also comes in 2 strengths. It's easy to decide which one is right for you. If you usually reach for your first cigarette of the day within 30 minutes of waking, use the 4 mg. If you can wait longer than that to light up, use the 2 mg. The lozenge should be moved around the mouth from time to time and sucked until it dissolves. This takes about 20 to 30 minutes. It's recommended that the lozenge be used for about 8 to 12 weeks. An inhaler consists of a plastic cigarette holding a nicotine cartridge which, when inhaled, provides nicotine. Each cartridge lasts 20 minutes. The inhaler provides hand-to-mouth action, just like smoking. The sublingual tablet is very discreet and may be useful in situations where chewing gum is inappropriate. It's placed under the tongue and left to dissolve and shouldn't be sucked or chewed. If you smoke 20 or less cigarettes a day, try using 1 tablet per hour. If you smoke more than that, you can use 2 tablets each hour. With all nicotine replacement products, it's important that you keep on using them for the right length of time. The sublingual tablet should be used for around 12 weeks. Though too much nicotine can make you nauseated, this is uncommon with nicotine replacement therapy. It's more likely you're experiencing nicotine withdrawal symptoms. If you're highly dependent on nicotine and you're using one type of nicotine replacement and still experiencing withdrawal symptoms or craving a cigarette, talk to your doctor about using a combination of 2 different types of nicotine replacement products. The patch can be combined with either the gum, lozenge, sublingual tablet or inhaler. This way you have the slow, steady dose of nicotine coming from the patch, and when you feel the need for a cigarette, you can use one of the quicker delivery methods. Some nicotine replacement therapy products can be used during pregnancy, and the overall dose of nicotine from these products is less than that obtained from smoking. Talk to your doctor if you've tried to quit without using nicotine replacement therapy and were unsuccessful.
Smoking's definitely not good for a baby, and there's studies out there that tell you that they're small for age and all sorts of things.
Before using nicotine replacement therapy, it's important to consult your doctor, particularly if you have any medical conditions. All nicotine replacement therapies can have side effects, but if you follow the directions, these can be minimised. The good news is that using nicotine replacement therapy is always safer than smoking tobacco, particularly if it helps you quit smoking for good.
People will say, well, we can do this and we can do that, but it's not an easy hurdle to get over, because you yourself are the one who's got to say, I want to give up cigarettes.
And remember that by quitting, you'll not only have more energy and feel better, you're really doing something for your long-term health and your wallet. Each week that you use nicotine replacement therapy, you'll be spending 50% less than you would if you were buying cigarettes. Of course, once you're no longer nicotine dependent, you'll be saving even more. In fact, it's important that you use your cigarette money to motivate and reward yourself. Each quit attempt improves your coping strategies. You learn more about what it's like for you to stop smoking, and you can put this experience to good use next time. Here are a few tips to help make quitting even more effective. If you make sure you eat a healthy diet, which includes plenty of vegetables, and exercise regularly, weight gain can be minimised. In the meantime, using nicotine replacement therapy can help to delay weight gain. It's a good idea to drink less alcohol for the first 2 weeks after you quit, as drinking can lower your resolve to stop smoking, and for many people, drinking and smoking go together. When you stop smoking, you can absorb almost twice as much caffeine, so it's a good idea to cut your caffeine intake from coffee, tea and colder drinks by half. Don't forget, there's a telephone service called the Quit Line to support you. They're experts, and a series of callbacks can be arranged, tailored to suit your needs. Go on, give them a call. Most smokers who succeed in quitting have tried to quit several times and gone back to smoking. If this has been your experience, it's good to know you can learn from this and put the knowledge to good use next time you're ready to make a quit attempt. Remember, you don't fail as long as you're trying. Get all the help and support you can, and you will succeed. Good luck.